What's new is that we are putting a lot more investment, number one, into tackling the 300,000 problem drugs users who drive about half of acquisitive crime and about half of the homicides in this country. Crime has been coming down overall in the last couple of years, but we're seeing a lot of problems caused by these 300,000 problem drugs users. So what we're doing is we're ramping up our campaign against the county lines networks that are preying on these users. You've got to invest in rehabilitation. Everybody who knows about drugs crime will tell you that 300,000 people, their lives are chaotic. They need to be taken off drugs. They need to be put into rehab. You've got to invest in rehab. But you've also got to come down hard on the gangsters who are making hell of people's lives. We want everybody to be able to grow up in safer streets. Everybody to have the right to have a safe community to grow up in. And too many people have their lives blighted by these county lines gangs. So you've got to do two things at once. You've got to be tougher on the county lines gangs. You've got to be tougher on the criminals who are doing it. But you've also got to make sure that you find those 300,000 people and you help them away. You can't simply arrest them time after time and put them back in prison again and again. You've got to do rehab as well. What we're also saying is that we're not going to sit idly by when you have lifestyle users also using Class A drugs, and we're going to be coming down tougher on them. But this is about being very, very tough on county lines gangs, ramping that up. We've already rolled up about 1,500 county lines gangs. We want to do 2,000 more.
Labour say there's been £100 million cuts in drug treatment. There've been cuts to police budgets over many years. They're right, aren't they?
No, so since this government came in, we've not only put 11,000 more police on the streets as part of our commitment to put another 20,000 more, but we're announcing another 300 million to tackle county lines gangs. Don't forget, so far, just in the last couple of years, under Project Adder, all the other anti-county lines projects that we've got, county lines operations, we've wrapped up about 1,500 networks of about 5,000 or so. We're going to do another 2,000, and what we're doing is taking the kids who are vulnerable, whose lives are being lost on the streets of this country because of the county lines gangs, putting them into care. So it's what this government is saying is, we understand that the drugs gangs are doing major damage to life chances of kids growing up in this country. I think it is a disgusting trade, and we need to fight it.
So you're going to take the passports away from middle-class recreational drug users?
Well, we're looking at doing things to tackle those so-called lifestyle drugs users who don't think that they're part of the problem. In the end, all the demand is helping to create the problem. The 300,000 problem drugs users. You've got to deal with what's going on there. You've got to make sure that they're given rehab. You've got to come down tough on the county lines gangs, but you've also got to think about what's happening with the demand, the economic advantage that is given to the drugs gangs by the lifestyle drugs users as well.
Sunday Times reported that a lot of cocaine use found in the toilets of Parliament. Can the public trust MPs on this issue?
Look, this government is absolutely determined to fight drugs and to make sure. I take the view that it's a long time really since you've heard a government say that drugs, Class A drugs, are bad and bad for society, bad for opportunity, bad for kids growing up in this country. That's my view, and I think it's something that we can tackle and we can deal with. You've got to be realistic. You've got to be humane. You've got to be compassionate. You've got to recognise that overwhelmingly the problem is caused by 300,000 people whose lives are simply chaotic, who are torn apart by their own addiction. You've got to help them. You've got to do rehab, but you've also got to come down very, very hard on the county lines gangs, and that's what we're doing.
On COVID, senior scientists have said you've brought the travel testing in too late. It's bolting this door after the horse has bolted. What do you say to that?
No, I think that what we're doing is responding to the pandemic. We were the first country in the world to take decisive measures to tackle Omicron. If you remember, we put about 10 countries immediately into onto the red list, and we said that anybody coming from any country in the world would have to quarantine for a couple of days. We're now going further and toughening those measures up as we see the spread of Omicron around the world. But I think what we need to do, everyone, just for everybody to understand, I don't think that we need to change the overall guidance and advice we're giving about Omicron in this country. We're still waiting to see exactly how dangerous it is, what sort of effect it has in terms of deaths and hospitalizations.
Can you say for certain, though, that we won't face social restrictions before Christmas?
I said, I think many times now, that I think that this Christmas will be considerably better than last Christmas, with the possible exception for the county lines drugs gangs that we intend to roll up today.